so I hope you're in the right spot. Quick logistics to take care of before I introduce our presenter. Please mute yourself today unless you're speaking. This is just to minimize background noise. Also, we are recording today's session. It will be available on the Whova platform for 3 months. Jacob is in the chat and available for any tech questions that you may have. We also ask that you use the Zoom chat during the session and not the chat that's on the Whova platform. My name is Colleen Phillips, and I'm a case coordinator with the Special Education Surrogate Parent Program, and I have held this role for the past 16 years. I, at this point, would like to introduce you to today's presenter, Meri Viano. Meri's the parent of 3 young adults and raises her grandson. She's the Associate Director of the Parent Professional Advocacy League, PPAL, a statewide family-run grassroots nonprofit organization that's based in Boston. Meri's worked for PPAL for 17 years. One of the key areas that Meri has created and been instrumental in PPAL is working on relationships with partners in the state to understand racial equity and white privilege. At this time, I would like to turn it over to Meri. Thank you.
Great. Thank you, Colleen. I really appreciate your support, Mary Beth and Jake as well, for the Federation for allowing us to have this conversation with you all today. We are very excited to have the conversation, and in the pandemic and post-pandemic, yet I don't believe we're in a post-pandemic situation yet. We're still seeing the effects of mental health and crises of trauma that has been impacted because of the pandemic. So really excited to be here with you all today. As Colleen had mentioned, I'm the parent of 3 amazing young adults. Their ages are 26, 24, and 22. My world has been rocked in really great ways with them, and some challenging components as well. I bring to you knowledge of raising children that have significant mental health needs, trauma, and unfortunately, some co-occurring substance use for my middle son. So I do feel that some of the pieces that I'm bringing today, not just from a professional organizational component, but also from the lived experience of being a parent and grandparent that has walked the walk, should I say. So honored to be with you all today, and we're going to get right into it. I do really appreciate interactive conversations. Like Colleen had mentioned, if you could put them in the chat box. I'm here with 2 members from PAL as well, Candace Cabri, who's the project coordinator for juvenile justice, and Pamela Bose, who was also with us. Candace will be supporting part of the pieces within the chat box as well, but we're really excited to be as interactive as we can and really have conversation of what is both going on within the state today and where we hope to get in relation to supporting families, children, and youth and young adults with mental health needs. So I'm going to talk a little bit about who PAL is in Massachusetts, how we as an organization connect to all systems, and why we want to be in your back pocket, similar to the Federation that you are all connected with. We're going to talk a little bit about the data that we have on telehealth, hospitals. I'm going to touch a little bit kind of anecdotally on school data, but not get into it in a big piece. I'm sure you're hearing from a lot of people regarding the education system. So I want to talk more about what mental health and how it's looking in trauma in the state today. We are going to talk a little bit about, and this is kind of the piece often people don't want to talk about, but we are going to be the real voice on what's going on in the emergency departments and the crisis for psychiatric care. And then we're going to end. We really want to be both in your network, like I mentioned, support you, and talk about the ideas that we have as an organization as we move forward. So PAL is 30 this year. We're really excited. We'd love to know in the chat box, how did you first learn about this? Is this the first time that you've learned about PAL? Welcome. Did you come to a training, go to a support group? Did you chat with us for information and brainstorming? We have some of the most amazing family support specialists across the state that will help you navigate and get back to you within 24 to 48 hours. PAL is a free service. We do not take insurance. We do not charge anyone money for our services. And believe as a nonprofit organization that we can support both professionals and parents. In our name, the Parent Professional Advocacy League, we believe and know that the partnership with professionals is as important as the partnership with families. It's also important to be able to teach professionals what families go through and what families tell us. And also, have you joined kind of with us to advocate to improve things in the state? And if you have not joined us, we hope you will join us after today. And if it's your first time again connecting, we welcome you. PAL, again, is a grassroots family-run organization, statewide, nonprofit. We promote opportunities. Our goal is to make any family a leader. We believe all parents, caregivers, youth and young adults, even with different abilities or disabilities, have the ability to be a leader. And that's really one of our guiding principles of who we are. Family organizations, I just want to mention, we have to have 51% of our board have to be family members as well. And that's how you get the term of and the status of being a family run organization. And nationally, we're connected to 3 different national organizations with an arm: the National Federation for Children's Mental Health. We're also connected to Youth Move National. We hold the Youth Move chapter for Massachusetts for young people. Some of you may have seen our young people speak, Dev and Steph from Youth Move. And then the third thing that we're connected to is Justice for Families, which is a national arm to some of the juvenile justice work. So I do want to make a shout out. This was our first year doing Children's Mental Health Week in green. If you don't know, everybody knows that breast cancer is pink. We want you to know that children's mental health, emotional, behavioral health, and trauma is green as well. We did 17 buildings we lit up. We believe in fighting the stigma. We often have said, and a past commissioner has said, which I truly believe, stigma in mental health is just discrimination. So we want to rise to the challenge to get the discrimination to go away for people with mental health. We lit up buildings that were green, 17 of them last year. In May is kind of our time, the first week of May. We sent out 225 toolkits were mailed out and 700 were downloaded. And we also did coloring sheets for young people as well. We believe also that having proclamations and keeping the legislator kind of right with us and championing mental health is important. So we also had 65 proclamations that were issued across the Mass legislature, and thank you to many governors and mayors across the state. In COVID, we began Facebook Live. You can join us on Wednesdays at 2 p.m. Our topics have ranged from what to bring to the emergency department when you go, strategies to combat stigma, tips for navigating special education, and how to parent perfectly if there's ever such a thing. So that's something that we definitely want you to tune into. You can also go on Facebook and see past Facebook Lives. So that's something else that we're able to also offer you. We've created surveys and tip sheets. We did do, and I'm going to talk about the data of what our report. We would love for you, both as parents and professionals with us today, to look at some of the surveys that PAL has created and bring it up in conversations where you're trying to shift the system, to really talk about what families have been saying. So we did do one on telehealth for families and youth, what their take. We did 2, one for parents and families to take, and then we did another one for young adults, because we believe that our young adult voice is really in partnership side by side with our parent and family voice. We did others on the juvenile justice component, how to become a community health worker if that was a field. We know that the workforce needs more parents to step up if this is an area that you would like to work in. Definitely be in contact with PAL. And also school anxiety and avoidance has been a very big topic that we also know is there. I also will make a shout out that we partner, and thank you, Catherine, great to see you. We partner with the parent-child trauma resources and connections, and believe that language, again, and partnering with professionals is a key piece. So I would definitely look and connect there. We built 2 websites because we just didn't think that having COVID and a pandemic was enough, right? But we wanted to make sure that we could get families the connections that we have. As you can see here on our website, you can request family support. A professional or a parent can request talking to a family support specialist. I just want to make another shout out. We offer multiple languages. It's free and you can make the connections there. Youth Move also created a website, which is really important. So now I'm going to just shift. These are some things that I think is really important, what we're seeing kind of in the systems that PAL connects to, but it's something to really be aware of. And I apologize, I'm going to say the acronyms out loud, but I do want you to know that, you know, typically I would be the person that's like raising the hands and breaking down acronyms, but there was only so much space on this PowerPoint to be able to tell you. So most of you know that DESE, the Department of Elementary and Secondary Education, is our school system. It's one of the entitlements of all children are able to be educated. And PAL sits on a few components right now, specifically with DESE. We are in the collaborative improvement and networking component, COIN, that really touches on mental health within schools, and that was an application process. If you're interested to know what school districts are connected to COIN, specifically on creating different tiers within mental health in school districts, you can contact PAL or you can go on the DESE website, which is really helpful. PAL has just got appointed a seat to look at grants that are coming in for $7.2 million to the school regarding the American Rescue Plan money that are coming in. And we're sitting to review grants that are being proposed by school districts. I do want to make a shout out, it's mental health related, but the two other pieces that it's related to is to really think out of the box on discipline, which is a priority to PAL. And the third piece is what would you also do effectively to shift the racial and cultural disparities that are happening possibly in districts. So PAL is very excited to be on that grant review. It's a quick turnaround. It's going to be 6 months. The applications are due on Friday. So if you know any school district, move fast and get those in. But again, it's $7.2 million. We are also working on, and I'll talk a little bit more about this, with the Children's Mental Health Campaign, where we're trying to offer technical assistance and training for teachers. And that's something that we're working on for, it's a legislative approach to be able to offer with some of the money that's coming in. I don't know that that's a definite, but we really believe in our teachers as much as we do. And just as, as important as a doctor, a lawyer, our teachers are tomorrow's children. So PAL really believes that the teachers across the state need to be supported in different pieces, specifically related to behavioral support, emotional support, mental health support, and to deal with the trauma components that are coming. PAL also sits, and if you don't know this, the Department of Children and Families has a family advisory council. So if you're supporting families, if you're a family yourself, or you're a professional that's supporting families, reaching out to the family advisory council is definitely something that you can do, and you can reach out to PAL. We are sitting and working on some strategic priorities with the Department of Children and Families for policy and training as a group, and that's part of the FAC, the Family Advisory Council that I had mentioned. And then PAL does have, we're very fortunate to be sitting with leadership on a monthly basis so that we're able to hear on the ground what's coming with the department and infuse parent voice. So all of these agencies, the biggest priority for us within PAL is talking about what we're hearing on the ground, what the experience is, and what can we do to make things better on behalf of families. We also work with the Department of Mental Health. We have a statewide contract. There are organizations that specifically are out there to do different things. And for our contract, we support children, youth, and families. So NAMI typically would support the adult, though they have some other programs that support children. Their main focus has typically been the adult supports, and PAL really focuses on the children. But again, there's some natural overlap that we do. So we support adults that are still living within families, or young adults that come to us. And there's a shared, I think, part of what is important, I think, across the state is that there's enough families for all of us to support, but how do we support them and what can we offer all of them? So Department of Mental Health has a statewide contract on with PAL specifically on policy, giving feedback and those next steps. We do have a regional contract with the Department of Mental Health. So for the Worcester area and North Central, kind of Central Mass area, we're able to offer lots of support groups, family support, one-on-one support. So that's not really a worry for any of you, but just know that we're there. We do have monthly meetings with the Deputy Commissioner. So we're able to, again, bring that and infuse family voice. One of my biggest and exciting and kind of, again, my family has touched many different areas. Another partnership that is close and dear to my heart is with the Department of Youth Services. One of the pieces that we're able to do that is really divert kids from being committed into committed care. We want young people not to go to courts to access services. We really want to meet them where they're at and support families. We do anything and everything in our power with the Department of Youth Services to redirect child requiring assistance, or CRAs. We do not believe bringing a child into court is effective or the best next step. So we're working together really to figure out what to do differently there. PAL sits on the governance. Again, we're meeting with the commissioner on a regular basis, policy, and we are part of implementing school to pipeline changes across the state and racial and equity for families, and really looking at why the majority of young people that are brought in, unfortunately, are Black and brown. And we'll talk a little bit about that. DPH, Department of Public Health, we're connected to the suicide prevention, substance misuse, and licensing of emergency rooms. And I'm just putting it there because we're going to get to a point here where often I was a parent that had experiences in emergency departments, and I was letting Department of Mental Health know. I never knew the licensing came from the Department of Public Health. So our goal is also to get the right information to the family the first time. We don't want you to have to either backtrack or get the wrong information. So just kind of a plug for you all to really know and be aware that if there are challenges in the emergency departments or hospitals, I'm not psychiatric hospitals, we're going to talk about that a little different. But if there's challenges, DPH, and I will give a link of, if you have got complaints, where to go. The Department of Developmental Services is also something that we're able to connect to on an interagency level. So often we bring there are families that are brought to interagency to talk about kind of strategically what do these families need or these young people need, and we sit there also to be able to support. Mass Health does have a contract with us. It's Boston specific. We have monthly trainings, meetings. It's our biggest, it's our multicultural outreach program. Joanna Rodriguez is amazing within PAL, and we're able to really offer and implement diverse programming specifically within that grant, which is exciting. We also partner really closely with Mass Family Voices at the Federation. So we also, that's something we're able to, again, we believe that the strength of partnership in bringing parent voices, very important. So often we know that we're sitting at a table either alone, or if there are other agencies like the Federation or Mass Families, we feel honored that it's three of our voices together to push change and not one. So that's an important piece as well. Let me just go to so what should you be aware of? So a few things just kind of, and we're going to go through this a little bit more. It's really important to know right now the school to prison pipeline, the racial equity and the challenges that are coming within the schools. There's a lot of conversation about racial equity just nationally, but the data shows, and you can't get away from what the data is showing, and I'm going to talk a little bit about this, but the data shows that children that are Black and brown or have a racial diversity often are not tested or evaluated as fast as a child that is white. And that is something that we know and we've been looking at, and I know that the Department of Elementary and Secondary Education is looking at as well in their pieces to be able to push through. But it's often something that when PAL as an organization is meeting with families, families of color have said to us that they have asked for help and it hasn't been given. And what has been given has been more of a disciplinary punishment than an evaluation and to look at what is the function of the behaviors. So I'm just making that shout out that, you know, it's really important to be aware of those. Right now in the state, we are also really questioning school resource officers in schools. PAL is in a belief that school resource officers are not the best next step. We believe in mental health counselors. We believe that schools should be a place to learn and be able to connect. That doesn't say, and I've met a lot of great school resource officers, but we're just saying in general, as a philosophy and systemic component, we would really like to think about and consider, as this pandemic continues, and when we get to a place of post-pandemic, I hope that we're changing our discipline approach, and our goal within PAL and other partners is to really look at a trauma-informed response when it comes to schools. And the word is only as fancy as the word is. It has to be implemented from the ground up and up down. So that's something we're pushing very hard in. If you haven't heard about the American Rescue Funds, it's kind of like when the Affordable Care Act came out. Everyone's talking about the money coming into the state and where it's going to land. We would love for any and all of you to get involved with your opinion and ideas of where you think it should go. We really believe that it's got to come to the community as well, not to say that workforce isn't an issue and there should be some money going there, but we also believe that the community and the parents and young people with the trauma that's happening now, we need some community funds to be able to do those next steps. Diversion, there's several diversion pieces that are being built, one on the emergency departments. So I'm going to give you a heads up on that. And there's also the diversion that we know within the courts, that this has been an opportunity with the pandemic. Is really eye-opening when the pandemic happened, that the amount of arrests for children went down. And as we've opened back up the world, kind of what is happening, and to keep an eye on that. And then again, the mental health crisis in the ER in the community, it's really important to both know it, be aware of it, but what do we need for next steps to be able to make it different? So here's my data friend, okay? He's gonna let us know when we're gonna go into data that is really important. I will tell you, and people that have known me in the field, I am a relationship person. I want to partner with people. I want to connect with people. I am definitely not the data geek at PAL, and I'm fortunate to have a lot of them within PAL that give me and get the information from families live. So I want to make a shout out to Lisa Lambert, who's our executive director. We've also have Kim Smith, who has been a project coordinator, and many that are also doing amazing and great work within PAL. So I wanted to make the shout out because as much as I'm joking that I'm the relationship person and I want to just kind of have the conversation, the great idea, the thinking out of the box, in order to push systemic change, data can help us. And if we know live data, we can push what families are saying that they really need. So here are a few pieces to just really keep in mind. The data allows system leaders to see the disparities. We can't, so as you're doing your work and as you read the work that PAL has done, I would love to see you take the data that we found, the Federation has found, Mass Families has found, to push the initiative to include families and include families the right way. So data really allows leaders and system people often to see the disparities when like day-to-day work, it's just really hard. It shows real numbers. It also shows where they occur. So I live in the center of the state. I've had the privilege of living in Boston for several years. I've had family that have lived in Western Mass, in the Southeast and Northeast, and it's different in different parts of the state and what's available. And that is the reality. We have to look at what happens and where it occurs so that we can both infuse and give those communities and supports the necessary next steps. It also helps to identify and evaluate policies or practices that are there. And I just want to give you I'll give you an example of where it has worked, both in a system level, but individual level. 8 years ago, I had the opportunity to work on a project with some family leaders that were connected to the Family Advisory Council of DCF, families that were connected to other nonprofit organizations, parent leaders, and PAL. And we had a hospital come in. And one of the policies that we were told pretty regularly, and I was a parent that experienced this, was that you could not have your cell phone with you if you were waiting for a psychiatric emergency. So if you've not, and I know, I apologize, I didn't say this in the beginning, some of what I'm going to say may be triggering to people. And I want you to know the reality that if you haven't worked it or walked through this, you know what families go through. When you go to a psychiatric emergency in this hospital, basically you are the parent as well as the child. All of your items are taken away and put in a locked file cabinet. So you don't have your phone. You're not allowed to have chargers. If you brought a magazine to look at, you're not bringing it in because there's a staple in the binder component. You are completely taken of your items. We ended up having a conversation, and it was what we called a listening session with several parents, and there was a large number, probably 40 parents that came. A hospital, at that point, we had also had people that were considering mobile crisis, which I'll talk a little bit about. And we ended up having the right people there to listen about the challenges from the perspective of families. There was never a policy that stated families couldn't have their cell phone on them. So that one listening session that lasted an hour and a half, and hearing the impact of what it made families feel and the challenges that it caused to parents, was changed because the right person was in the right room, hearing from people of what the impact was. That couldn't have been done as a group. I mean, I was knocking on doors as that individual's family, and I think I'm a pretty loud, for people that know me, a parent that's out there. And I was saying it in meeting after meeting after meeting myself, but it was the impact of the amount of people, I'm just saying like data point again, right? The amount of people saying the same thing in the same space, and then finding out there was never a policy. And it was something that the hospital admitted to, that there wasn't a policy, but the impact that it took was very different for the families that would come. So it really is a piece to consider as we shift what we need to shift with the disparities for mental health. So the next slide, I'm going to get into data. I'm just giving you kind of a heads up on this. In 2020 and 2021, and this data was kind of a snapshot just in April, PAL reached the highest level ever for phone calls coming in. Families found that they were receiving fewer supports. They had no help. They didn't know how to figure it out. They didn't know what benefits. I'm just, giving a shout out that, again, the highest experiences that were named for us were kids that had anxiety, depression, and suicidality. Suicidality that had come for kids that typically weren't a child that showed mental health or emotional health was coming up and skyrocketing. The numbers have continued to go up, and we continue at PAL to bring up the suicidality of children, both in attempts and young people that have died by suicide as a problem in our state. We've also brought up, PAL has brought up that the data on suicide is almost 2 years behind for states to know the impact of what's happening. And that's a challenge for us, as it should be a challenge for all of you here with me today, to know that if we are in crisis and we're in a national emergency, we would know for 2 years after or a year after. So that is also a challenge that we're in constant conversation with, to be able to shift that. PAL did a telehealth survey, and this PowerPoint will be available on the app. It's not up there yet, but it will be, I promise. Just want to give you a few things kind of shout out. I mean, a lot of people are saying telehealth is the best thing. We believe it is a great tool. We also know and heard from families that it has not worked the best either. So I want to just make that point. So in May, we did two surveys. We did a survey for parents, and we did a survey for young adults. And we asked them what they knew and what they could tell us. 91% of people that use telehealth said that this was the first time in 2 months prior to being able to do that. 39% said it was used for outpatient therapy. 29% said it was for psychiatry. Another 29% said that the child's pediatrician was the piece that really was the beginning, and those were the connections. Similar to parent responses, the young people told us that 89% of them reported that they had already used it. So very close to the 91% of what the parents said. 61% reported that this was their first visit in the previous 2 months of the survey. The top findings for us, and I'm going to get into the recommendations, everyone is talking about telehealth is the best thing since sliced bread. If it works for you, it works for you. And if it doesn't, it doesn't. So the challenge for us in PAL is we're not trying to take away something, but we want people to really consider what families have told us. In the top findings, the largest majority of families, 76%, reported that they had access to strong internet signals. 21% said it was inadequate. We have families calling us that are walking to the nearest library to get free internet or a fast food chain to do telehealth appointments. That is often the reality of what families are going through. While one parent reported that they had no internet, almost 1 in 10, 7% of you said that they did not have internet or were unsure if the signal was even adequate. So again, going in and out of appointments. Several parents, they did say that their internet was fine. But when we break it down, also telehealth visits by computer, 42%, and I'm making this again to a point of 42% said that they were using a laptop or computer. Cell phone was 31%. So again, thinking about, I know what it does to me with using a cell phone for telehealth. I know the challenges. And to use that with no ability to have a laptop, I'm not sure I could do family therapy or some of the other components that are there. And I'm just saying my own perspective, but it was shown here that 31% had to use their cell phones. 12% use their tablets. And I will say, if any of you are questioning, why is that number so low when Chromebooks and tablets were given by schools? Because for some school districts, you could not use your tablet or Chromebook for telehealth. And that was a conversation that we had early on to say, if we're going to help people in a pandemic, I think we really need to deal with some of these challenges. However, African-American parents reported that they were most likely to use their cell phone at 61%. So again, the racial disparities of access and equality came up in telehealth and continues to come up. So on behalf of PAL, I hope that you can use some of those results. We're going to continue, and I'm going to tell you some recommendations that we found. In here, I'm not going to go through all of this, but the downloading the app was a huge challenge for families. The state access right now, if you haven't heard, I'm sorry to bring the news, but WebEx for the state is being shifted to Microsoft Teams. Microsoft Teams has been one of the most challenging apps that families have said, and that is going to be the state platform coming soon. We really ask families to ask anyone, any provider, not just state providers, if Zoom is the best access for you within telehealth. Your voice and your advocacy for what works for you, we hope that you push that to be the priority for your family. Some drawbacks of telehealth that we've heard is, loss of interest from children. And we're talking about mental health, right? I mean, I have to tell you, I started by saying my children rock, which is, they've rocked my world in many ways, both in the positive and the challenges, right? And that's part of parenting. My child struggled, that has bipolar and multiple levels of trauma and challenges, to get the apps to stay within the phone. And even within the tablet that I had bought him was really hard. If he signed in late and he was later than 5 minutes, he missed the appointment. So from my perspective of supporting an adult child, it was extremely hard to get him to do the telehealth. And then there were providers that were excellent. They would walk through how to use the app. They would call him in if he couldn't get the app to work, right? But I have also raised advocates. And it's very important for all of us as parents or professionals that or providers that support children and families to make them advocates by your side. Some of the drawbacks that came: telehealth visits, lost interest, the worries was definitely a piece. So here's some recommendations. One thing at PAL that we can always promise you is if we bring up a problem, we've got a solution that we think that might help. We do not believe in just bringing problems to you. We want to be part of the solution. We want to be creative, and we want to bring these next steps. And we believe and notice that families do the same, and young people. So here are recommendations for providers from families and young people. Help troubleshoot technology issues if you're going to use it with people that you support. Routinely check in. Is this working, or do we need to go back to face-to-face? Ask families and young people again, what is working or not working. Really check and ask the question, how's your internet connection? What can we do to make it different? 40% said that internet access was a challenge. Offer help with setting up apps before the first appointment. It's kind of like Tech 101. I need that. Young people said that their parent needed it. Some of them needed it because of the access of their device. And also talk about distractions and privacy and what is going to be that connection for families if that becomes a challenge. So I don't know if there's any questions in the chat box specifically on telehealth. I'll give it a few seconds if there are. Okay, so now we're going to get into mental health emergency and trauma. We have noticed an uptick in families that are going to the emergency departments by ambulances. We have noticed for mental health emergencies. We have also noticed and have been told by police officers in the increase of what we would call a Section 12, or a young person that is brought, has to go to the hospital. So a legal situation that there has to be a transport by, and our hope would be by ambulance, not by police cruiser, that there's been an uptick with that as well. This is a snapshot. Just to make a shout out to people, Pamela is going to be in charge of our Facebook page and some of the pieces that are there. Our executive director sits with the Mass Hospital Association, and they're looking at what the waits look like. And you can see these snapshots. I know it's small, and if you're on a phone, my apologies. I'm going to just give you a snapshot of a reality of last week. So every week, PAL receives, because we sit again in a policy meeting with Mass Hospitals, the data of what we're seeing and the snapshot of what's here. When we talk about the emergencies and emergency departments of what's happening right now I just want to give you a few terms before I go through this. We're talking about behavioral health. We're talking about psychiatric emergencies. This information I'm going to go over is not related to an injured bone, needing a cast, having a heart issue, going in and having a medical need. This is very specific to behavioral health, number one. Number two, there's a term known as boarding, which means if you are in an emergency department and you are waiting for a psychiatric bed or waiting to be assessed, you are there for X amount of days, okay? If you had a heart condition, if you had a infection, you would go into the emergency department, and the next step would be, if you were to be admitted, that you would go to an admitting floor. The majority of young people across the state, and there are a lot of hospitals trying hard to do this differently, majority of the children are awaiting treatment, a bed, in an emergency department. So I had talked about when you walk in and all of your items are taken from you. That still happens in an emergency department. And sometimes there's not a separate place for behavioral health or mental health. Some hospitals have that, but there are several that don't have that. So you're in the emergency departments. So this is a snapshot from a week ago, Monday. Last week, there was a total of 644 people across the state that were boarding. Sorry, the week prior. The week of the 8th, there was 564. There is 182 children the prior week, and then 167 children last week across the state that were boarding. But though you see 167, I need to tell you this is 167 children that have not reached the place to deal with the behavioral health, mental health, traumatic experience if they need inpatient hospitalization or a CBAT level. Sorry, and Candace can get the CBAT piece in the chat box for you. But one of the pieces that I want you to know is in these amount of children that are waiting, majority of them are waiting over 2 weeks. PAL is working with young people under the ages of 18 that have been waiting 40 to 50 days in an emergency department for psychiatric care. So though this number is very high, and we feel that it went down from 182 to 167, we know that the winter months are coming. It typically jumps up. Our data across the state has shown that mental health emergencies do go up in late winter and early spring. And for this year, there has been no drop. Now, one of the pieces that has happened within Massachusetts is there's supposed to be an expedited emergency protocol that happens. And what happens is someone within the state is aware that there's a child boarding. There have been several hospitals in the past year that have opened up with some hospital beds, some for adults, some for children. There have also been several hospitals that have been closed, not because of COVID. They have taken less because of COVID, but they've been closed because of complaints of safety, abuse, or neglect in psychiatric hospitals. So there is this balancing act right now that's happening, and this real crisis that is continuing to happen across the state. Mary Beth has a great question on the average boarding component. If Candace and I were to go into the hospital with our children together, not on the same day, and I've been waiting a week, and Candace goes in today being Tuesday, Candace could have her child placed in 48 hours, and my kid could still wait. The conversation in the state has been that the milieu, which is true, milieu is a term that's used in the children that are in a certain hospital, and who can they handle or not handle to be able to take. But the challenge is some of the most acute children are waiting more than the child that walks in that needs psychiatric care, but for whatever reason, maybe wasn't hospitalized prior to, doesn't have the behavioral or acuity that my child may had, gets a bed first. I will tell you personally, in 2010, I was on the front page of the Boston Globe because my child was too acute to get into a hospital, and I waited 4 days. And it was 4 days that I can't imagine being a parent that's waiting 30 to 40 to 50 days for no bed. We also know I'm a complete person that believes in diversion. And if you do not need hospitalization, PAL wants you to access the supports in the community. The Department of Mental Health has created, in response to this, a diversion that can happen from the emergency department. But the emergency department and the Department of Mental Health are the decision makers of if your child would get that next step program. If you want more information on that, please contact PAL. It's very new. We believe it's very exciting. I would tell you it's close to what appears to have been created with a term called a continuum, where you have in-home therapists in your room X amount of days or times. There's a 24-hour crisis number, not connected to mobile crisis, but to the organization that has been hired. And there's some real time limited intensive supports that can happen. The challenge being, you don't know what you don't know. So my goal is to try to just, push information out so we can all know the information to be able to get. So I really hope that when you hear the emergency department crisis, I've brought a bit of light to you in what it means and the crises that we're looking at. Because if Candace's child had a heart condition and could get in for a heart procedure in 2 days, why is my child waiting 30 days to have somebody deal with the brain? It's a real challenge. And again, I will just like to make the shout out. I don't think we're just dealing with stigma. This is discrimination. And what do we need to do as a community together? I'm going to make a little bit of a shift. I don't know if there's emergency department questions. I did see Meri Beth's in there, but I can answer some more towards the end. There is a term also called, oh, sorry, Meri Beth, thank you. Do you have to be, some hospitals, again, I'm going to go back to the hospital policies. If you have any questions, PAL is here as a resource. For some hospitals, hospitals will say that if you are not with your child, they will file what's called a 51A, and this is perfect because I'm going into child welfare. There are several families that are also dealing with this, and we talk about having sitters or people there. We also know that children that are in foster care remain in the emergency departments longer. And I know that the Department of Children and Families is really looking at that as well. So it is something, Meri Beth and others, that it comes up often, and we would hope to be able to have that conversation. I would also just kind of going to that, boarding is it's been a longstanding problem. I agree. We also know, so what other states are doing is that the infusion of community resources and community resources to not just therapy, therapeutic mentoring can definitely help, but also peers, parent peers, young adult peers has been an area that has been worked in many states. The mobile crisis component, I know, is actively trying to continue to work through the ups and downs that are there. We believe, and I've been a family that has experienced excellent response with a mobile crisis. I've also been the parent that didn't have the best experience, but went and talked about what we could do as the solutions, like anything, right? Like if you get the wrong pediatrician, what do? Yeah, there's a way to kind of do that advocacy and make the connection. So there's ongoing conversations, but I really, any families that want to give their experience to PAL, and whether you're named or not named, it helps us to push that initiative up. And we are looking at other states and what they're doing creatively to think out of the box. So this is going to go into kind of the juvenile justice and young people that have interagency involvement. And there's this term called, I didn't make up the term, it's the term that's there, crossover youth or dually involved youth, sometimes you'll see. So I just want you to know that, there are several young people that are involved in multiple agencies, and my children, unfortunately, we had multiple agencies, and there was a fortunate piece, but it was also a challenge too. So I just wanted to, this is data that came out a year ago, and 40% of young people that are in DYS, the detention population, have an open DCF case. And it's really important to also know that 72% of the youth committed to DYS had prior involvement with the child welfare system. I tell you this not to push blame, but say those are the parents I want to reach before they need another agency, right? At PAL, at the Federation, at Mass, like we want to support families from the beginning. The majority of the young people that are connected to DYS have had their first intake by age 5 with child welfare, nearly 40% by age 3. 50% of girls, 40% of boys that have experienced multiple home removals. We want to work with foster parents, adoptive parents. We want to work with long-term parents, kinship parents, grandparents. We really want to work with anyone because we believe in the best piece for families and parents and children is knowing the information to be informed and to make choices. I do want to tell you we are involved in girls initiatives. There is only one location. If a child that identifies as female goes into DYS, there's one facility across the state for children. And we don't want them to get to that facility. We want to do anything and everything involved to be able to support the opposite component. The other thing that I just need to make the shout out to, and anything that you can bring up in this conversation, and we urge you to join in our school to prison pipeline summits and conversation. Again, contact Candace Gabri at juvenilejustice@ppal.net. While youth of color make up 33% of the youth population in Massachusetts, 40% of those are arrested, 60% that come into DYS are arraigned, 66% have had a violation. So the disparities of fairness for us is across the board. But I want you to know these hard conversations need to start happening within the schools. So we believe in order to interrupt and end the school to prison pipeline, we have to really look at what are we doing to the most vulnerable children in out of school suspensions? Who are we expelling? And there are some young people, and I'm sorry to say, Massachusetts has expelled preschoolers. What are we doing in a state? Are we transferring young people that have needs, but don't need to be in alternative settings for behaviors, but maybe need to be supported in trauma-informed and infused schools? What are we doing together as a state in zero tolerance policies? And there are many school districts doing many things, but it's something to really think about. This is some national data. I will tell you the data within the state, because we're not like Pennsylvania, just give you an example of another state that goes by county to county and can have data. It doesn't matter if I'm living side by side with Colleen and Candace, all three of us have school districts that follow very different policies. So in Massachusetts, it's made it very hard to get the data, but we believe that we've got to look at some of the pieces that are there and what are we going to do to the next step. I don't have the data to mention to you, but I would urge you, and I'll try to get it on the app as well for this conference. The school to prison pipeline, one of the keynote speakers talked about young people of color being pushed through school systems and were illiterate when they got to high school. And the amazing data that was shown on behaviors that were showing were so young that could have been interrupted, right? Because part of this, we don't want to just get to the solution. We want to interrupt when a child has a behavior that they need to be supported, and a village around both the schools, the teachers, and the children. It's really not one without the other. We want to be able to support the teachers and administrators as well, but the zero tolerance policies is extremely challenging. We're also not sitting here and believing every child needs to have an evaluation for an individualized education plan. But if there are needs that show, the opportunity should be given, right, in that next step. So I hope you can join us in PAL to shift that school to prison pipeline. We're really excited. PAL is a partner with the Children's Mental Health Campaign. We have been from the beginning. This is one thing that you could do now. I know that we had received a question of what can we do now? How can we be involved? We are trying to push to address the barriers for mental health in legislation. We've been working with the campaign. We've been working on our own in different policy components. And there are going to be pieces that come out, but specifically around the American Rescue Plan money that is coming in. We're really hoping that there are areas that are there. So that's something, again, you can find on our Facebook, you can find on our website, and you can definitely be connected. There is a debate as highlighted here that's expected to begin on Wednesday, the 17th. So getting in any and all of your ideas, information, or what you think is needed would be great. And that is something PAL is connected to many partners across the state to be able to get to that next step. So if you know me, and if you don't know me, hopefully you've gotten to know me now. I believe in racial justice. I believe in just naming white privilege for what it is, but I also believe that families should be informed on where to file complaints, but also be part of solutions. So here's just a few pieces to know as a shout out, hopefully that will help you if you ever need it. And if you don't need it, you had the information, but you didn't need it. Number one, if you need help with the expedited process for emergency departments, please email PAL at info@ppal.net. You can also go on our website, like I had showed you earlier, to request family support. Do you have a complaint on an emergency room? File this with the Department of Public Health, public health license emergency rooms. And there's a video and it's in multiple languages. You can also file complaints, and just let you know, the only way sometimes change happens is to have a bad experience to shift more positive experience. And we never want tragedy or trauma to happen to anyone. And that's something, unfortunately, that has happened where we've been able to shift policy. Excuse me. In that, you can also see, in that you can also see how to file a complaint on a physician, a nurse, or the hospital of how you've been treated. If you have a complaint specifically on a psychiatric hospitalization, you can email Janet Ross at janet.ross@state.ma.us. And Janet is working closely and would be able to walk you through those next steps to be able to do what would be needed as far as getting help. We also believe, like I said, we're a very close partner with both the Federation, Mass Families, NAMI, some other organizations. And many times we share the ability to help families and kind of split what could we do, what could they do, what were the next steps, because we also believe that the families that know us should know the other organizations that are advocacy organizations. And there's not a lot of advocacy organizations that are free and available to families, but those are a few of the ones that I've mentioned. So 3 things to consider if you want to join in on PAL as well. As I had mentioned, we're parents of children, we're family members of loved ones that have emotional, behavioral, mental health needs, substance misuse components, and we are also partnering with professionals. We believe that professionals side by side with us are those next step. So why would you consider to join into PAL? So these are the 3 key things. And there's a phrase that's often used within PAL from the executive director to myself and through the staff is, our goal is not to change one thing for one family. Our goal is to change the system for all families. And that's something that we do by doing 3 things. We strategically partner with people across the state, and we would love to partner with you as a parent, as a young person, as a young adult, or a professional that's in the field. We would love to work together in influencing the best quality of care for young people and adults that have mental health, emotional, behavioral health needs. And the last word that nobody wants to talk about is we want to advocate. We want to change the map. We want to change it for all families. We want to have an equitable situation for families. We want families where our data showed that when a family of color walked into the emergency room was 3 times less to receive a chair or a glass of water is wrong. And we're in it for the equity. We're in it for the purpose to change how partnership and how families are viewed that have children with significant needs. So the 3 things I would love for you to join, and I'm not saying you have to speak with the media. I'm just saying to join in on our systemic partnership, how we're going to influence, and how we're going to advocate together, because there's a lot of work to be done. So we would love for you to join us. So what do we need from you, or what can we offer you? Number one, we can offer you free confidential school clinics on Tuesdays. You just need to email juvenilejustice@pal.net. You don't have to have an individualized education plan or a 504. You can talk about what's happening with schools, and we can work with you how to partner with the schools and be informed of your rights. You can join us for a statewide meeting. You have to be a parent or a caregiver of a child or a young person that identifies with having someone that you love in your life. To a statewide meeting with the Commissioner of the Department of Mental Health on January 11th. Commissioner Doyle is coming, and my goal is to have 500 families show. Last year, we were close to 200. In what we're seeing in the state, I need all of you to come and let Commissioner Doyle know that this is a priority for you. And I also urge you, if you do not have a child, and I don't right now have a child that's in kindergarten, but kindergarten priorities are important to me. So if you are connected in some way, please email statewide@ppal.net. Join in on our trainings and our newsletters. A shout out on the Facebook Live. There's amazing Facebook Lives, as you know, with the Federation. PAL is doing them as well. We're doing them on Wednesdays. You can follow us on Instagram and more. And then there is support for both professionals, parents, and young people at info@ppal.net. And that's something that you can find. We are going to be uploading additional languages of information, specifically on timelines in special education, how to talk to the police for a child that may have the first reaction or connection with police, and also what do we do in school avoidance, because we're having real challenges after this pandemic of making sure that children do show to schools, but how do we support them to get to that next step? And those are some of the opportunities that we have. Oh, I don't know what I hit. I'm sorry. Okay. And then, like I had mentioned, info@PAL is kind of the place to be. You've got my information, Candace's information. She can also share that in the chat box. We do have about 15 minutes for questions, which is great. I've got more to also tell you to give you a heads up on, but I would love if anybody has any specific questions or situations that you've had that you'd love to mention as well, please let us know.
So Mary, one of the questions that kind of came up, well, many questions always pop into my mind, but do you want to speak a little bit to placement? There are so few beds available. And I know that one of the situations a lot with parents is that they'd like the child to be within a reasonable distance from them so that they can go visit, but that's not the reality.
Thank you, Mary Beth. I think that we talked a little bit about that with the Department of Youth Services on facilities that they have, and it really is a challenge with families that want hospitals for different reasons, right? I mean, there's so many different complexities that are there. Often you can, and parents have the right to say what facilities they would like and they would not like. But going back to Mary Beth's point, there are only so many beds across the state. So part of the question and strategic kind of planning that we give to families is to say, if you were willing to go further than what's comfortable, making sure that FaceTime is available, making sure that there's still a connection, what would transportation be like or be offered? Those are your rights to also ask of other facilities that are there. The other thing also is that you can talk about, and if you have private insurance, I didn't mention this, if you have private insurance, some of our families, again, we're insurance blind, so we talk to anybody and everybody, including parents outside the state. But one of the things to keep in mind is that your insurance company, when you enter the ER, should be the first line of contact to call, because they're going to be the people that also do not just the bed search, but they will determine if you have a child with acute needs and they want to determine a higher rate, and I'm sorry to say this, but it's a higher rate to place your kid, that can be a benefit. For instance, for a child that have violent behaviors, very acute suicidality and attempts, even within the emergency departments, the insurance can determine to pay a one-on-one, and that in some ways will make hospitals move to accept your child because the risk changes to their ratio of staff. So your first line of contact really should be the insurance department and PAL and other family organizations. The second piece is knowing your rights and being able, I want you to know your rights first, but often in a crisis, I have to say you end up where you end up first. And then we think about this at the next step. In your rights, really thinking about also, what does that placement have that they can offer your child to stabilize? So if your child had a bad experience somewhere, part of what we've told families, if you're saying your child cannot go to a facility, you have to give the reason why, because if it's not on paper, you look like you're just the picky parent. But if my child had trauma at a facility and cannot go back to that facility, or has an eating disorder and they don't have a nutritionist and a nurse that understands eating disorders, it's important to push forward what the needs of your child is. The other piece that is there is definitely the challenge within the state, in that if, and I'm just looking at kind of the top of my screen, if Colleen, Candace, and I all have children that go in the same week, but Colleen's goes in on Monday, my child goes in on Tuesdays, and Candace goes on Wednesday, Candace's child can be placed first. And that is a really hard component for families to understand. Personally, and I know I'm being recorded, it's really hard to see when hospitals cherry pick who you want. And my kids aren't going to make that basket of fruit. And I've seen it and I've experienced it and I watch it. And I think the state is trying hard in expedited processes to have conversations of what to do. But I can't tell you that if the three of us all went in for the condition of a heart condition, we're all getting beds at very different rates, probably the same time or before the next one comes in. When you have parents that are also challenged with this, it's a real big piece. Derek, I do want to make a shout out for you. Some great resources of family resource centers. The challenge being all family resources work very differently across the state. So like I would tell you to interview my staff at PAL, you need to interview family resource centers. You need to interview family support centers within DDS. You need to interview schools. You need to be aware and also interview and support kind of next steps. I say often as parents, I never knew, I think in the beginning as well, that when you have, there's teachers with different, there's personalities everywhere, right? And there's people that are going to work and not work. And Mary Beth and I could be interviewing the same people. And maybe Mary Beth loves it. And I'm like, this isn't going to work for my family. Part of the component that we believe for parents is that, again, interview, ask great questions. And if the need isn't met, I believe, and the nice piece, again, I want to just make the shout out to you, Derek, in mentioning it. There's the staff at the family resource centers, there's many. So if there's one bad experience somewhere, I would hope that if you called PAL and had a bump, that you'd call PAL again and talk to somebody to find your need that's met. So that would also, as far as for families, be informed, know your rights. We want to teach families their rights from the beginning, because if you don't need them, that's okay. I don't want you to be the parent, like me and many others within, I'm sure, this session, that not only did they not know, but nobody told them, and somebody could have been the person that influenced the information to tell them what their rights were. So that's another piece that's there.
Mary, I'd just like to add too, that if people have questions regarding special education rights, I specialize in mental health for the Federation as well as trauma. Reaching out to RTSC is a good idea. And many times I'm going to send them back to you for other information.
Right.
I also want to add that the family resource centers are increasing in numbers. So for example, out west, if you are at the Family Resource Center in Holyoke and it's not working for you, there is one in Springfield.
Right.
So there are more centers. Some of them are situated relatively, those are 20 minutes apart from each other, that it is possible even through public transportation to be able to access those.
And I think that, and Mary Beth, going to your point too, I think that the nice piece is for family support centers with the Department of Developmental Services, you have to be eligible typically for DDS to go to the family support centers. For the family resource centers, there's not that level of eligibility, right? That is supposed to try to take down and allow that definite level of support. The other thing that I wanted to make a shout out for too, that there are several support groups across the state. So right now, the Department of Mental Health funds community and school contracts. So across the state in Western Mass, the support network is a great component in Western Mass, that specifically works with navigating high level needs of mental health needs. So I'll just mention them: the support network of Western Mass. There's Wayside within the Northeast area, Parent Information Network that is in the Southeast. PAL does have a regional contract as well, and the Home for Little Wanderers in Boston. So some of those regional contracts, you do not need to have eligibility with the Department of Mental Health to get supports from them, though some of them, because they're based within providers, have provider eligibility. So it's something to watch, just be aware of. Again, that is out there. And that's often something that is not known because they work very closely with family resource centers, because when the acuity gets so high for suicidality, self-harm, maybe violence that is there, sexual exploitation that possibly having with young people, which is challenging, that's also a place to be able to connect. And I would agree with what I had said earlier, and Mary Beth touched on again. We really are in this belief of kind of letting families know all the information. So it's not uncommon for PAL families to go to Federation events, like we are almost sister organizations, I think the closest, right, that have connected. I would say we're just as close with Mass Families, again, for being shared disabilities, but also like disabilities meaning abilities, right? Different abilities. And we really believe across the board in strength-based approaches. And we believe that family voice and parent voice should have a place at every table. And I would do the shout out for Mass Family Voices as well as Family Ties. There's a lot of shared programs within the Federation that we tap on each other. And I'm one of those families that all of my children have connected to all state agencies, except I had the ability with my knowledge and partners within the state to keep my children out of the Department of Youth Services. Though my child was incarcerated as an adult, which was definitely challenging, and I don't mind sharing it because our journey connects us to people that have walked the walk. And I think one of the things that often we say is this multi-agency involvement can be really difficult. So reach out. PAL is available here. This is an amazing conference. I'm going to hand it over to Colleen in a minute because I know that she's going to close us out, but just last minute questions or information that either I missed or I could touch on.
One thing I would just like to put a plug out that I'm not sure that many people are aware of, there is an agency called Health Law Advocates. And within them, they have the mental health advocacy program for kids. They are attorneys. They're lawyers fighting for healthcare justice. They are housed within the family resource centers as well as their headquarters is in Boston. But if you feel like you need another step, these are attorneys that specialize in mental health with children. So it's another area. They may direct you right back to us, which is, we like to do that. The circle goes around. And I just have to put a plug out as well for the statewide meetings that PAL holds. I try and attend as many as I can. I miss them being in person. I miss
I know.
hugs. So,
So
but
true.
it is amazing the advocacy that has begun from a parent attending one of those meetings and getting the fire going under them. And next thing you know, they are forming their own nonprofit or their own help agency, or they're handing out their business cards because they've been through it. That's the one thing I love about PAL, is that we've all been through it. And so
Right.
you're not talking to somebody who has studied it, you're talking to somebody who's lived it.
And I would just as a thank you, Mary Beth, and I'll throw out a few. So Health Law Advocates is on the Children's Mental Health Campaign with us. A few other mental health legal advisors is another component. We're connected to the Office of the Child Advocate, though I always say, you don't go to the superintendent when you've got an issue at school, you go to the teacher first. And the Office of the Child Advocate, or an ABUDS person that we do have in the state, is another component. For substance misuse, for those of you, I don't want you to feel that you're alone. Learn to Cope is an amazing organization. Massachusetts Organizing for Addiction Recovery, or known as MORE, MOAR, is another piece. And I would not do my justice if I didn't shout out to the 365 dads and Seeds for a Father in Western Mass. Fathers rock and need to be pulled in even more. And as a grandparents raising grandchildren, but also there's a lot of grandparents that are connected to the Federation and PAL. Again, the family in the state, if you could talk about fathers, if you could talk about grandparents, and you could talk about that young people in foster care get to identify who their families are and define that, I think then we're pushing the initiative in the state. Keep in mind, LGBTQ youth end up both homeless and not supported a little bit more than others. So if that's another component that's there. On behalf of PAL, thank you so much for having us. We really appreciate it. I'm going to hand it over to you, Colleen, and we're in your backyard, so please reach out anytime.
Great. Thank you so much, Meri. I really appreciate it. What a wonderful presentation. Again, this presentation will be on the Whova app for 3 months for anyone who has missed it. It is now 11:30, so this is about to shut down any moment. So please head on over to check out some of the exhibits, and then we will reconvene at 12:30 for this afternoon's keynote with Nancy Rappaport, and you won't want to miss that. So thank you very much, and we really appreciate it. Have a wonderful rest of the day.
Thank you. Bye-bye.
Bye, everybody. Thank you.